Hello, my name is Dr. Quinn with Ozark Holistic Center, and today I actually want to talk to you about thyroid problems and how we tackle thyroid problems here in the office. Most anyone that comes in that we suspect a thyroid issue, we do run a whole series of blood panel. What's common nowadays is a lot of doctors will run just a couple of things. They call it TSH, which is the hormone from the pituitary to the thyroid to tell it to produce thyroid hormones. And they'll kind of use that test as a general scan. If it's normal, then they go, hey, your thyroid levels are normal. Sometimes you'll see also with that run T3, T4, which are the two hormones made by the thyroid itself. And the same thing goes. They do this generalized scan. If those are normal, then they say your thyroid levels are normal, your thyroid's fine. Sometimes we'll find that those are off, and there's particular cases where that will occur, but there's a lot of other tests that we run too to kind of get a full comprehensive look at somebody's thyroid. And a lot of times you'll see the issue be in these other tests, and yes, they do have a thyroid issue, it's just not being picked up on. So we'll usually run TSH, free T3, free T4, active T3, active T4, also reverse T3, and then you also run what we call thyroid antibodies. Anytime you're looking at the possibility of an autoimmune condition, you want those thyroid antibodies in there. That actually means that people are dealing with more like Hashimoto's or an autoimmune to the thyroid, and you can actually have that occur without some of the other thyroid hormone imbalances. And this will come about, sometimes people even know it, they'll realize that they're starting to feel off, or that they've been feeling off for a while, but it's not long term, or they're just not have as much energy as they once used to have, or they don't feel completely there like they once did. And then that's where we'll start seeing the beginning levels of something being out of balance. Once you identify that, it then usually becomes pretty simple. We use that calculation or that number as well of our in-office what we call muscle testing and muscle assessing to come up with a plan of what herbs we're going to use, what foods we're going to remove from people's diets in order to get them better. Commonly, you'll see gluten need to come out, soy come out. Those are some of the common food sensitivities. We'll often use what we call adaptogens, which are particular herbs used to help the body produce certain hormones, and even some of the actual what we call glandular products themselves. Iodine is something that we look at, especially with thyroid, as well as your other minerals. And so we use, again, that blood work, our in-office testing to come to a plan of how to restore those levels back to normal. And it takes a little bit of time, but usually people start seeing results within just a couple of weeks if you're moving in the right direction. I often find as well anemia issues attached to thyroid. And so anytime I'm looking at the possibility of a thyroid problem, I will run iron levels and ferritin levels as well. And usually, again, I will identify that first in what we call muscle testing. And then you can also sometimes connect the thyroid imbalance to the iron issue with muscle testing as well, and use that system to get back to what supplements need to be taken for both of those. If we find the iron issue in there, which more and more I'm realizing is most often there, then we also couple that with teaching people how to do more breathing exercises, breathe right, try to get more oxygen in the body as we're increasing the iron saturation and increasing iron levels in the body. And all this combined together kind of becomes the plan that we use to work with thyroid. And so we've been doing this for quite a while now. We get really good results with it. If you watch this video and you've been a client that we've worked with thyroid, we'd love to actually see your comment on it, or maybe a couple talk about your experience of working with us through that problem. Thanks.